Respiratory illnesses are on the rise in North Carolina. We've been telling you about this. In fact, new data released today show cases of RSV are the highest we've seen since last December. All of this comes at a time when supplies are limited for an antibody drug meant to protect infants from the disease. WRAL's Destiny Patterson talked with a doctor who says new forms of protection are an important part of preventing serious sickness.
It's that time of year where you need Kleenex on hand and you notice people around you starting to cough and sniffle. It's not uncommon to catch illnesses like the flu and RSV, and in recent years, COVID-19. One doctor that I spoke to here says trends for these illnesses have slightly changed since the pandemic.
A smidge early to already be seeing a bunch of cases, similar with RSV.
RSV cases measured in participating hospitals are up 31% since last week and 94% from the week before. It's part of an increasing trend that started towards the end of August, but new forms of protection are available for vulnerable groups.
I was really excited when we finally got an RSV vaccine on the market that's approved for our older individuals, especially with medical comorbidities, and that there's a new antibody that can protect infants from RSV disease.
Flu cases are also up slightly compared to last week. The good news, COVID cases are down by 10% week over week. COVID hospitalizations and wastewater data are following that downward trend.
But is there a reason why there are some viruses that are more prevalent as opposed to others?
RSV and flu both are classically very seasonal viruses. COVID hasn't always obeyed those seasonal trends exactly.
Due to the COVID vaccine and natural antibodies, he says more people are protected from serious COVID-19 sickness. Of course, Dr. Turner says vaccination can help reduce serious sickness. However, the RSV shot that can provide protection for an entire season is in short supply. The CDC advises doctors only give that shot to high-risk infants. You can find out other ways to protect you and your family on WRAL.com. Destiny Patterson, WRAL News.
And more on that, in most cases, if you catch the flu or RSV or COVID, you'll likely have mild symptoms.
Even the mild symptoms, though,
you
don't want those either. And
exactly.
the ways to protect yourself, stuff we're used to, things we became familiar with during the pandemic, hand washing, keeping space between you and others when you're out, even, right? Yeah, there you go. Wearing masks at times, the best ways to lower your chances of getting sick.